Hello everyone, welcome back to my YouTube channel. Today we are going to talk about chronic pulpitis. We will start our topic with introduction. Chronic pulpitis is long-standing persistent inflammation of dental pulp that progresses slowly and is generally less painful than acute form. In this, the pulp remains partially vital, but the tissue has undergone degenerative changes over time. Chronic pulpitis can be asymptomatic or present with mild dull discomfort and is often detected during routine exam or radiographic examination. Talking about how can we define chronic pulpitis. Chronic pulpitis is low-grade, long-term inflammatory condition of dental pulp that is characterized by gradual degeneration of pulp tissue and minimal or no pain, often associated with deep caries or large restoration. Now let's talk about etiology of chronic pulpitis. The etiology may be long-standing dental caries. Poorly adopted or leaking restoration can lead to chronic pulpitis. Repeated trauma or irritation to tooth, mild but persisting bacterial invasion can lead to chronic pulpitis, and progression from untreated reversible pulpitis can also lead to chronic pulpitis. And cracked tooth or irritation exposing dentine is also the causative agent for chronic pulpitis. Now let's talk about types of it. Types for the first type include chronic hyperplastic pulpitis, that is also called as pulp polyp, that occurs in young individuals with open carious lesion in molars, and in this the granulation tissue grow out of the pulp chamber and it is usually painless unless traumatized during chewing. The second type of it is chronic inflammatory pulpitis, that is also called as non-polypoid. It is common in older individuals. The pulp is partially necrotic with chronic inflammatory infiltration, and it may show signs of fibrosis and pulp stones and calcifications. Now let's talk about clinical features of chronic pulpitis. Clinical features include dull, mild pain or discomfort, and it may be asymptomatic. And patient may have history of past pain that has now subsided, and it may experience pain on chewing or thermal sensitivity, and there is large caries exposure or all restoration often present. Tooth may be tender to percussion or may not be tender to percussion depending on inflammatory status. Now let's talk about pulp vitality test in chronic pulpitis. We do the cold test that has mild or no response. We can do the electric pulp test that has delayed or reduced response. In heat test, we may provoke mild lingering response. Now let's talk about radiographic features. There is deep caries lesion present, and there is the radiograph may show widened periodontal ligament space or beginning signs of periapical pathology. There is no definite periapical adolescency unless pulp necrosis has begun. Now let's talk about histopathological features of chronic pulpitis. There is chronic inflammatory cell infiltrate that are mostly lymphocyte and plasma cells. There may be fibrosis of the pulp tissue and formation of calcification or pulp stones. Degeneration of odontoblasts is also associated with chronic pulpitis, and there may be granulation tissue, especially in hyperplastic pulpitis or polypoid pulpitis. Now let's talk about diagnosis of chronic pulpitis. So diagnosis of chronic pulpitis is based on clinical history and examination. Then we can also do radiographic finding on when we can confirm the chronic pulpitis, and we can also do pulp vitality test, and sometimes histology is also can be done if the pulp is removed. Next, we will talk about how we will manage the chronic pulpitis. Since the pulp cannot return to normal, we do root canal treatment. That is standard treatment to remove inflamed pulp, disinfect gland, and restore function. The second thing we can do is extraction. That is considered when the tooth is non-restorable or RCT is non-flexible. The third option may be vulvotomy, that may be done in chronic hyperplastic pulpitis in young patient. That is removal of coronal pulp followed by sealing to preserve vitality in the roots. Now let's talk about prognosis of chronic pulpitis. Prognosis of chronic pulpitis is good, especially when diagnosed early and treated properly. And delay in treatment can lead to pulp necrosis, periapical abscess, or chronic apical periodontitis. So this was about chronic pulpitis. Hopefully you liked the video. Don't forget to like, share, subscribe, and comment.